Today we're going to talk about complications of obesity. As I said just now, people are not aware or they are ignorant about it. So first of all, what is TeraHertz? TeraHertz lies between the microwave and the infrared. It is part of the spectrum, including normal light. So this is the frequency and the trillion power. So what is this used for? It's mainly used in telecommunication. Okay. Any of you who use a 5G phone, that is microwave frequency. 6G, which is coming, is terahertz wave. So that's to give you an idea where it is. So the interesting thing is that every molecule have a frequency, and the frequency of our cells inside our body is in this terahertz rate. It's kind of like a fingerprint. So because of this frequency, terahertz has health effects because it affects our body. So that's where it is. What they call the electromagnetic spectrum stretch all the way from radio waves all the way to X-rays and all that. Now on this side it is very toxic. That's why you don't go for too many X-rays, right? You have too much X-rays, your cell can mutate and turn into something that is abnormal. So this side is safe. And if you have been to a campfire or something like that, or you sit with your back facing the morning sun, as some people recommend, you feel very good, you feel warm, the heat makes you feel nice. That's the effect of infrared. And terahertz is far infrared is here, then microwave and then radio waves. So terahertz come in when we develop new technique to both generate the frequency as well as to detect it, then we can monitor it. And the breakthrough was in 2011 when, in the olden days they don't have enough printing material, so they tend to paint over other people's face. So they could look through and uncover the name of the artist in the painting that was beneath. And today this is being used. You know that Qin Shi Huang and his terracotta army, they dare not open because they are afraid that the atmosphere will cause everything to collapse, right? So they are thinking of using this. And in fact, they are using archaeology now to see through things so that you know what is underneath without opening it up. So before we could generate this, there was what is known as a TeraHertz gap. Why is there a gap? Because we were able to study radio wave and microwave included under electronic, right? On this side, visible light here was studied under photonics, that's under light. So this in the middle, what method do you use? If you are abreast of the news, you know that China is making photonic chips. Photonic chips will be here. So using this technique, you can study this. So that's technology. So what is it used for? As I say, it's in telecommunications, 6G, and because you can look inside things, it's used for military security. As you know, when you pass through customs, they scan your body, right? They're getting better and better, and terahertz is the latest technology they will be using. There are YouTube videos that show you how other things will detect, but terahertz will detect firearms, things like that. And then it's also used in agriculture. In China, it's used for monitoring drought, and what they do is that they use terahertz to look at the leaves, at the moisture, water content. When they get less, they know that a drought is coming and they can take action. It's quite amazing. And of course, because our cells resonate at the frequency, it has health and science implications because it resonates at the frequency of our body. More important is non-ionizing like X-ray. It doesn't cause your cells to mutate, so it's very safe. That's why Japanese call that the light of life. So where does the healing properties of terahertz come from? One aspect of it is the heat. We know that infrared can make you feel good, and there are infrared saunas which are very healthy for people to go and the circulation improve and all that. So terahertz far infrared share the same property with infrared. It can penetrate, it can stimulate a lot of things and push out, improve the circulation. But far infrared is more than heat. So this is better than infrared. It's better because it has a vibrational frequency. How do scientists know? When they shine infrared terahertz, they remove the heat element. So our device, there's one device where you can get cold terahertz wave. The cold terahertz waves is also effective. So it is the vibration that heals, right? And it can be used for visualizing inside of your body, fractures, tumors, things like that. And for bones, for instance, terahertz can detect 3 different layers in the bone. Is that sharp? So it's used for diagnosis. If you look up the internet, you find there are plenty of articles on how terahertz is being used to make diagnosis. Then terahertz is also used for therapy. It can heal. And many people discover one of the earliest substances to have this property was certain stone. Now we know what it is, so they are called TeraHertz stones. And these stones have health healing property. I'm sure you come across them. People selling you stones that's supposed to give health. Well, what are the properties as far as science is concerned? Number one, it doesn't harm yourself, it's not ionized. It penetrates through all kinds of materials. That's why people can use it for military and security applications. But it is absorbed by polar compounds. Polar compounds are compounds that conduct electricity. And water is a polar compound. Water conducts electricity, you don't know? So, and because these compounds conduct electricity, they absorb terahertz wave. The energy in terahertz wave is very tiny, correspond to what is known as hydrogen bond or van der Waals force. You see this in water. If you pour out a glass of water, you know that the water, after you pour out the water and you put it upright, water is still there, isn't it? That's because of what is known as surface tension. They hold the water together, and this water, these forces that hold the water together is hydrogen. So terahertz can break these bonds. That's where you get terahertz water, isn't it? And when the bonds are broken, water can flow easily. Water then slide, the molecules slide over one another. That's why terahertz water is powerful. So because human cells resonate at the same frequency, and different parts of your tissue have different degree of hydration, different amount of water. So they can be distinguished by the fact that there are different concentration of water in different layers, and that's how you can see things. So what are the effects on the body? Okay, these are the main things. I will go through them. They open up our blood vessels, the molecules that get activated, and of course the factory in your cell get activated as well. Hyperactive cells get toned down, and your DNA gets activated. So we go through this one by one. So one of the most important effects of terahertz is that it open up blood vessels. When it open up blood vessels, blood flow through easily. When blood flow through easily, the tissue gets all the good stuff, the oxygen, the nutrients, the vitamins, anything, the antibodies, kill invaders, and so forth. When they go back to the heart, all the bad things go. Carbon dioxide, the waste products, everything return to the heart. So when you open up the blood vessels, not only is it's a better flow, you get more nutrients, but it also remove waste products. And that's very, because a lot of times in conditions where your tissue gets swollen, it's because of the waste product. And if you can remove them, your pain, whatever, swelling, everything gone. The other thing is that it regulates inflammation. These are white blood cells that whenever there is a breach or whenever there's an attack by microorganisms, bacteria and so forth, these cells will come to protect you. But in the process of protecting you, because so many white blood cells come together, you also got inflammation. It means that chemicals released for the purpose of killing or removing foreign bodies. But in the process, the inflammation also causes the tissue to be swollen and irritate you and irritate your system, your tissue system, as well as cause problems. Because if you put out toxic substance to kill foreign bodies, it can also attack your own cells, isn't it? So that's why inflammation sometimes not always good. So it can come down and regulate it and it activate normal cells. This is a mitochondria. Inside your cell there is this mitochondria. Mitochondria is a factory inside the cell. It produces all kinds of things, all kinds of molecules that you need. It produces energy in the form of ATP. It synthesizes things, metabolize things, and so forth. Anything that your cell needs to do is done in the mitochondria. So by activating it, let's say you need to fight against some bacteria or virus, TeraHertz can activate this. Not only it activates the cells, but also every cell has a life cycle, right? 60 to 120 days. At the end of the life cycle, you got to remove those cells that are kind of beyond its useful life. So when the cell has gone past its useful life, the cells naturally will break down and they begin to release chemicals that signal find me, eat me. So cells that are no longer useful, have expired, going to die, that's how they are removed by your body. So you can say that every 120 days you got a new you, because all the cells in your body have changed, have been renewed. Then The other thing is it can kill bacteria. That was how I discovered TeraHertz. It was during COVID when it was shown that the COVID virus is killed by TeraHertz. So if you have a cough and cold, you can use it and blow it on your nose, on your face, and on your lungs. It will kill all the bacteria. Or if you have fungus on your body, it can do the same. And it can activate DNA. You know, DNA is in 2 strands, in case you don't know. There are 2 reasons why you need to unzip the DNA. Open up the 2 strands. One, when you want to duplicate your DNA. You want to make another one, so you got to use one strand to get the information to do the other strand. The other reason why we want to unzip the DNA is when we want to make the DNA contains the instructions for making your proteins and all kinds of hormones that you need, right? So there's a reader called a primase and a primer here, which basically read the instruction and produce protein that your body needs or whatever that your body needs. Okay? So let's talk about obesity. Obesity is defined by something called the body mass index, because essentially it's your body weight divided by your height twice. So you can calculate your BMI. Myself, I'm about 24. So if you are overweight, between 25 and 29, that's overweight. If it's 30 and above, it is obese. Okay? And obesity is considered to be a disease, right? People who are obese, in the past, people live longer if you're obese. In the days when we don't have good medicine, because when you are fat, you have a lot of storage of energy. And in those days, when people don't have enough to eat, you have excess fat, you are supposed to be healthy, full. Abundance. Okay. Nowadays, overabundance. So this becomes a liability. So obesity is therefore caused by your behavior, your eating behavior, but it can also be caused by genetic factors. So eating patterns is very important. Some people are on a seafood diet. You know what's a seafood diet? What you see, you eat.
Seafood.
A seafood diet. Some people are like that. Once they see food, they must eat. So that's terrible. Also physical activity. If you are not active, then of course you don't burn up the energy that you take in. If you don't have enough sleep, sometimes it make you fat. And how you play, how you live your life impact that. If your life you just spend, not doing anything, lazy, bumming around, as I say, yes, you can get obese, especially if you eat a lot. It can be caused by genetics. Some people, for families, that they've always been fat. It may be genes, it may be because in the same family they have the same behavior, right? And of course, some illness make you obese. So it's important to understand. Normal weight, overweight, obese, class 2, class 3. This is really obese. Causes: overactivity, inactive, overeating, medication, sweet drinks, gut hormone. Ever since Coca-Cola came about, sweet drinks have been very common, isn't it? You go and buy a kind of drink, always sugar inside. And so that's where it is. It's calculated this way. Weight, kilogram, height in meters square. Complications. Now, this one is important. This one is important. This one is important because when people have a complication of obesity, they didn't connect the two. So an obese person who has osteoarthritis or has gallbladder disease didn't quite connect that their disease is due to obesity, unfortunately. They have a heart attack, heart attack is a totally different thing. They didn't quite connect that it's obesity that gives them the problem. Because oftentimes it's obese first, then they develop high blood pressure, then they find that they have high cholesterol, then they find that they're diabetic, or heart disease, or strokes, or gallbladder, or whatever. So I'll take you through to help you understand what it can cause you. And sometimes after they got this, they try and reduce weight, the damage is already done to your body. Okay? So there you are. It can cause 13 types of cancer, stomach. These are some of the more common cancers that we have in Singapore, right? And see how many of them are related to obesity. There are also mood disorders, in other words, psychiatric illnesses can be caused by that. Alright, so this stroke, heart attack. Wow, high blood pressure or hypertension. About 50% of adults have it. So it's likely that some of you maybe have high blood pressure and you're on medication, right? I myself. It's a major risk for diseases of the heart, the brain, kidneys, and the extremities. Extremities, especially the legs, you have all the arteries get hit by high blood pressure. You can get pain called intermittent claudication. So it's due to high blood pressure. So it can lead to all this heart failure, disorders of your heart rhythm, even dementia can be caused by it. And yet, a lot of people who are hypertensive don't know, unfortunately. Okay, now we have blood pressure machine. You just put on the cuff and you press a button and you measure. So more people are aware. but they may not seek for treatment as well. When your blood pressure is high, your heart got to work very hard, and that's where you got the high blood pressure. You see, when your heart got to work very hard, then your heart can fail, right? And when your heart fail, that's where problems start. So it can be managed. Diet, exercise, medication, and medication is important because if your blood pressure is at a certain level, there is nothing that your body can do. You will have the effect. So there's a contribution by genetics. If you're male, you're prone to have that hypertension straight away. Just the mere fact that you are male. Certain races have more hypertension. Certain age, as people grow older, women after menopause will be prone to hypertension. This is the fact. So certain things are known and you can't change because of it. Now we used to define hypertension as anything more than 140/80. Now no. Through research, through surveys, we now know. Now the standard is anything that is more than 120/80 is high blood pressure. But now the treatment target is 110/70. So because I'm a heart patient, my blood pressure must be below this. Thankfully it is. Why? Because they follow up people. If you are normal, you can be higher than this. If you don't have heart disease, you can be up to 120/80 and it's okay. But if you have heart disease, they find that you are better off if you're below that. So these are the new standards as a result of years and years of study, and we begin to understand what is the risk of high pressure. So lifestyle change is very, and you got to reduce other risks. If you really want to treat high blood pressure, you got to reduce it, no choice. And you got to stop. And alcohol, very moderate use of alcohol. 2 units, 2 beers or 2 glasses of wine. That's it. Anything more than that, problem. There you are. Normal, less than 120. Less than. So the effects of this. One of the things we discover is that after the Viagra was invented, a lot of people go to see doctors because they can't perform. When they evaluate these people with sexual problems, they find that they have high blood pressure. One of the results of high blood pressure is that it's seen in places that you least expect. Sexual problems highly indicative as loss of vision. All this can indicate high blood pressure. So imagine normal, your blood can pump out the water, the blood very effectively. When it's high blood pressure, your heart got to work harder and blood may not flow through easily. So just to stress, your blood pressure must be below that. So you got high blood pressure, sometimes have symptoms, headaches, dizziness, vomiting, all that, even nosebleed. I once have a blood bleeding from my nose, shooting out blood from my nose. That's due to high blood. But people may not link the two. That's an unfortunate thing. And we still see people, have you heard high blood pressure as high as 180, 120? This is the hypertensive crisis. If you are in A&E and you work there, you find from time to time there are people coming with this kind of blood pressure. It's serious. The person can die. So it must be brought down immediately. And people, if they don't measure their blood pressure, nowadays with the blood pressure machine, you should be able to. But if you don't, it can go that high, and you may not know. Of course, we are seeing less of this hypertensive crisis nowadays, but we still see them occasionally. The person who kind of don't monitor. So much about high blood pressure. If you have high blood pressure, you've got to seek treatment. There's no two ways about it. If you want to just change your diet, change everything and try to bring it down, if it's not down, you must take medication because your life will be shortened. That's the bad news. That's the bad news, unfortunately. And the other thing is that when you are overweight, it not only give you high blood pressure, it also causes other. When you're overweight, eat a lot, what happens? Your cholesterol, triglycerides go up, your fats. And when they go up, they also cause problems. But these are important substances for your body. Cholesterol is used for making your cell membrane and hormones and vitamin D. It's important. Triglycerides, which is your fat or your oil, they are stored in your body because they are required for energy. When you are not eating through the night and everything, they are mobilized as sources of energy. So it's essential. So in other words, when your body needs it, when you are dieting or when you are on a fast, your triglycerides or fat are released for energy purposes. And cholesterol also serves a function. HDL cholesterol absorbed in the blood and carry back. HDL cholesterol is a good cholesterol because they take all the fats out there and bring it back to the liver. LDL cholesterol take the fat and bring it to the cells. And sometimes along the way it gets deposited in your arteries and that's where they give problems. So there's a VLDL, very low density, like so. Besides HDL and LDL, which you know about, there's a VLDL. They carry fats and cholesterol, which can be deposited in your blood vessels and form what they call the plaques. So traditionally, this is the bad cholesterol. How to lower your fat inside your system, inside your arteries? Lose weight, exercise, change to food that are low fat, such as fish or vegetables, less drink, maybe bring it down. So cholesterol, when there is HDL, will remove the cholesterol in your blood. LDL will bring the cholesterol into your blood vessel and into the cells. So what you want is somewhere. But if you don't exercise, if you don't do those things which brings up your HDL, then of course it won't work. That's why exercise is important. And triglycerides, your fats get deposited. See? So these are what is known as the cholesterol, normal cholesterol level. If really most, you want to get it in milligrams, you just multiply it by 38.67. These are the desirable. Those in time. Very low density lipoprotein, which carries a lot of fats, is about 1/5. Divide this by 5, and that will be the amount of very low lipoprotein. This is undesirable, or LDL, so you want it to be as low as you can. This is desirable, and you want it to be as high as you can. It is brought up by exercise and by certain foods that you eat. But the best way is to be active to bring this up. So nowadays we routinely do your blood for cholesterol, right? I'm sure all of you have done it. And if you don't have any disease, that's okay. You can observe. In times past, a lot of doctors, if your cholesterol is high, they begin to start giving you medication to bring it down. Some people have said that this is unnecessary. Well, that is true. That perhaps for some people, a high cholesterol is useful. Certainly, if you're vegetarian, chances are you have high cholesterol. Why? Because vegetarians tend not to get their cholesterol from the diet. So the body produces all the cholesterol to compensate, see? And then if a person whose family has been vegetarian for many years start to change the diet to taking meat, their cholesterol often go up, okay? Because for generations they have not been taking meat, vegetarian, so the body compensates by producing cholesterol. So if you are that, and if you're not aware that your family genetics is like that, and you take meat, then your cholesterol go higher. You understand? So there's this balance. And if you have disease, then cholesterol becomes very important. People who have disease will need to bring their cholesterol down and bring their HDL up. The cholesterol they remove. So leafy vegetables, fruits, whole grain, nuts, all these things. So for me, for instance, cholesterol is bring down to about 100, considered low, 100, 120, thereabout. And the cholesterol is important if you have heart disease. If you have heart disease or diabetes, this becomes very important. Diabetes. If you are overweight and you are on a seafood diet, you eat a lot, you have high blood sugar. When your blood sugar is high, in your body, insulin is supposed to bring down the blood sugar, isn't it? But if your sugar is high all the time, insulin, no effect. We call this insulin resistance. Your body's blood sugar is resistant to insulin. And if you understand sugar is a very hyperactive molecule. Why sugar can give you so much energy is because it is hyperactive. So automatically your sugar in your blood will react with other molecules like protein, your fats, anything, DNA. And this chemical reaction is called glycation. Anything can react with sugar molecules and you will be glycated. The result, AGE, H. You actually H. H stands for advanced glycation end products. So you should, in between meals, try not to snack or eat anything in order to reduce your blood sugar down. So that your sugar in your blood won't be so excess that it starts reacting with everything, proteins, fats, everything. And you get glycation. Glycation leads to stress, oxidative stress. In other words, it's called ROS, reactive oxygen species. And you take antioxidants, why? Because of this. And ROS can cause all kinds of things, all kinds of diseases, cancers, etc. Everything. Degeneration. Every time there's trouble, every time there's disease, you look, it's because of ROS. Reactive oxygen species. Because glucose is very active. When it reacts to anything, the oxygen is exposed. When the oxygen is exposed, that's when it will grab any negative ions at the bottom, highly react, and it causes all the damage. So once you understand this, now you understand why it's important to lose weight and to reduce the intake of sugar. Okay? So therefore, when you have all these ROS, they produce all the problems in all the various parts, the skin, your eyes, your nerves, your heart, your kidneys, everywhere in your body. Glycation can be slowed down once you reduce your blood sugar in your system. It can be reversed and it can be prevented. Reduce your blood sugar, reduce the amount of sugar in your system, take lots of antioxidants, take lots of fruit, take lots of things that are able to eradicate the effect of, so there you are, sugar. Any other molecules leads to glycation. This is best seen on your skin. If your skin is sagging, wrinkles, age spots, rough skin, dry skin, they are AGE. They're the result of it. So too much sugar doesn't make your skin smooth and beautiful. It's the reverse. You cause the skin to look like that premature age. Because sugar will react with anything. Your face, for example, beneath your face are a lot of collagen, right? And if you go to people who do cosmetics, they inject collagen to make your skin look. But sugar will react with the collagen, and then you produce all this. Not nice. Age prematurely if you eat too much. Then the other thing is that there is something called a metabolic syndrome. When you're overweight, you have high blood pressure, high blood sugar, and you have high cholesterol. These three things, blood pressure, blood sugar, and cholesterol, gives you a lot of problems. It's called metabolic syndrome. Why? Because this is exactly the thing that causes damage everywhere, from the kidney to your nerves. Of course, people who are overweight never connect. They didn't know, but there's a name to it because we know. People who study, who do research, discover that these three things connection. And of course, when you have high cholesterol, high fat, your triglycerides is high because you're overweight. All these things combine together. It stresses the body because your body is not getting enough good things. So it's important, therefore, if you are overweight, to look at your blood pressure, your blood sugar if it's high, and your cholesterol. See? And in the previous talk on diabetes, I talked about sensors, right? You don't have to prick your skin every time to get blood and measure the blood sugar, right? You can just put a patch there and you automatically measure it. Now it's even better. Now you can wear a watch, something like this. This is a smart watch, and this watch can measure blood pressure, can measure a lot of things, but it cannot measure blood sugar. There's another watch that can measure your blood sugar, and I read in the news recently that Samsung is going to put out a smartphone or smart watch that can measure blood sugar. They're already, when I got this and realized it didn't measure blood sugar, I went out and checked. Yeah, there are watches about same price, below $200. They can measure blood sugar and all this. You know what this means? You don't have to prick your skin. That means anytime you want to know. So after you had a wonderful meal, see what it is in real time. Very, very useful. So in the past, we used to prick. You have a needle, prick, and then you measure. Then we have this sensor, put the patch and the app on the phone, and you know your blood sugar. Now better still, you wear the watch, blood glucose is there. No excuse, right? It is very important because many people don't realize there was one time anti-diabetic medication called the name said never mind. A lot of people were taking this anti-diabetic tablet. Why? Because they want to prevent the blood sugar going too high, so they want to bring it down. Because the higher it goes, the worse it is. Doesn't matter if 2 hours later it comes down, but the peak, the height of it is it. So they're doing this. Then when this thing come along, and you can measure in real time and see on your handphone, oh wow, you take a donut, oh just a donut, but you really go wow, you know in real time. See, this is what we want, because if you can regulate in real time, you realize where the danger is. All the healthy foods, you remember this Jimmy Carter, still alive, the wife passed away. He was a peanut farmer, isn't it? I used to snack on peanuts. Peanuts is very healthy. Peanuts, if any of you with diabetic related relations will know that peanut is a low GI food, right? Low GI means for the amount you take, the blood sugar is very little. It rises very little. That's why nuts are healthy. It brings your blood sugar level down, and you can know it. Get a smart watch, monitor your blood sugar. It tells you exactly where you are. Now, these are the complications of diabetes, all caused by glycation, like the spontaneous reaction of sugar with various things, protein in your body, and then the glycation causes the metabolic syndrome, which causes all this damage. The overweight person can't understand why his eyesight is failing. He cannot quite connect that the eyesight is connected to overweight or to your kidney or nerve damage. When your nerve damage in the blood vessels, as well as the nerve, pain and numbness, and after a time, you don't feel the pain because the nerve is dead. That's why your feet get infected and you don't know. You see people who are amputated, right? They're usually diabetics. The nerve dies, the blood vessel dies, right? And tissue begin to die. And when tissue dies, it turns black. So when you see black wounds on the leg, that means the leg has to go because it produces enough toxin to kill you. And that's why the surgeon says, you want your leg, you will die. You want your life or you want your leg. So people want to live, so they amputate. That's what happens. And of course you can die from heart attack, brain. I have a very good friend of mine. He's a good man, you know. He's also a missionary. He was in Pakistan. So one day he was, I said, what happened? Say, doctor say I have a heart. Why doctor say, don't you feel the heart? No, I can't feel it. So I asked him, are you diabetic? He said, the doctors just found out. He didn't know. So diabetic, he has high blood pressure. He's not obese, but I suspect that probably the way he eat, if I eat so much, he eat 3 times what I eat. So very sad. He eventually died. Yeah. So these are the risks because weight, overweight, cholesterol, all these things. And if your behavior lead to all these things, no amount of TeraHertz warning will help because you've got to change your behavior. See? So how does overweight give rise to heart disease? This big word simply means we say that your blood vessel, all the fat deposited there, isn't it? These deposits are called atherosclerosis, and the medical term for the deposit is called atheroma. So the atheroma in your blood vessel, because of atherosclerosis, is the reason why people who are overweight, who are diabetic, or whatever, have heart attack and stroke. This is the reason why. It's a thickening or hardening of the buildup of atheroma inside the plaques made up of deposits of fatty substances, cholesterol, waste products, calcium, and fibrin. Fibrin is a component that gives your clots. So it's a consequence of diabetes and all the things that we talk about, you see? And it's also the result of metabolic syndrome. High blood pressure, high cholesterol, high sugar, and all the problems. Heart attack, stroke, kidney failure, blindness, nerve damage, tissue damage, everything. Take note, starts from 10 years. So it's only a child, give him, sugar, everything, give him. You know, you're starting the process early. You know, because of better medical service, we are able to do autopsy. And in war zones area where children died and they did the autopsy, they were surprised. Infant, there are changes in the blood. That's serious, you see? 10 years. Foam cells, abnormal cells start to be seen. By the time you're past 10, you're going to see fatty streak. By the time you're 20, you're going to see a little bit of blockage here. By 30, 40, when you're more than 50, I got my angina when I was 53. So probably this was building up, isn't it? When you reach 50, you see, if you do your angiogram, blood is falling down. Even here, your vessel, your artery must be at least 70% blocked. Then you begin to have 70% blocked is almost here, isn't it? Right here, right? You have a heart attack when it's more than 80 or even 90. So in other words, you're totally asymptomatic. You won't know. Not unless you put in a dye to visualize it and you say, oh, it's narrow here. So when I had my heart attack, 53 years, it was in some major arteries. There were of some narrowing in other arteries, but they were less than 7. But after another few years, about 8 years later, I did some more stent to be because those originally that were less than 70 has increased to 70 or more %. So you need to put a stent in. That's how I end up with 7 stents in my heart. So that's how it evolved, you see. And it can be blocked to quite a degree by your atheroma, and blood still can go through. So no symptoms, you see. That's what happened, right? And the thing is, sometimes when your plaques burst, when there's bleeding, blood clots form over it. So your plaques, your atheroma, is formed of all kinds of waste products, clots, everything, and it narrow it. So acute myocardial infarction is what people call heart attack. When you have a heart attack, the damage to heart tissue is irreversible. Anybody with a heart attack is weakened. And because your genetic risk, male, family history, whatever, can be eliminated. Survival of AMI patient, you can survive beyond 10 years, it starts to gradually get less. So it is very important to know that because this reinfarction reduce heart attack is very important. That's why you must take steps. If we could, we must repair. 20 years ago, the first such study, when you flood the body with stem cells, inject stem cells, it goes to the heart, it can repair damage. When I had my heart attack a few years later, I went for a review. They did the test. They said the place where the heart attack was, they're now scar tissue weakened. So I have been interested in anti-aging medication, and I was taking stem cells. 2-3 years ago, went examination again. Cardiologist at the National Heart Center was very happy. He said, your heart is as good as an 18-year-old. I didn't quite figure out what that means. Then I realized, 18-year-old heart, you see just now the picture of the artery, 18 is very good, you know. So what he's saying is that, yeah, all my blood vessels, all the heart, all the blood is flowing freely, no obstruction. It means all the stem cells I've been taking have caused the healing, the damaged tissue. That's why it works. Only stem cells can repair damage to heart tissue and damage to any other tissue as well. Only stem cells. Stroke is a heart attack. A stroke is a heart attack, but it occurs in your brain. That's all. You see? So when you do a PTCA, which is percutaneous, which is a stent, PTCA means a percutaneous thing. It can lead to small pieces of clot being thrown out and it enter in your brain. So in fact, some years after my stent was done, I did a brain scan and they discovered small tiny clots all over the brain. This was probably let loose when they did the stenting. And if you got a major stroke, then of course you got half the body paralyzed. There are many kinds of stroke depending on where in your brain is. There's one kind of stroke in your brain, which is midbrain and thereabout. That part controls your breathing and everything. If that part of your brain has a stroke, you can't survive. You don't live long. I've seen a few, two, where they die almost within the day. Few hours, you can't survive. But when you have minor strokes like this, like after a stent, you get sensory strokes, you get mini strokes, you get lacuna strokes. All these terms means that the strokes are minor and they affect only a part of the brain. I have some what they call lacuna strokes, minor, few mm in diameter. Few mm is small. So I noticed it because I couldn't balance myself. So when I went in for a check, sent me to hospital, they found that it was a lacuna. So slight imbalance, slight inability to do something, it could be due to a minor stroke. If you have a heart attack before, or you have a sensory stroke, or some of this minor thing, which indicate that you're prone to your blood vessels being blocked. That's what it is. Unlike heart attack, where your figures are much better, strokes are. After 5 years, 26. After 10 years, 40%, which means your risk of stroke increases with time. Once you know this, you know why once you have a heart attack or stroke, you need to be on medication. It doesn't mean that you have it and after you recover, that's it. No more problems. No, this thing always haunts you, because once your body has this disability of having a stroke, it will come back again. Hence, therefore, it's very important to recognize that whatever risk factors you have, you must quantify them and eliminate them in your life. Live a healthy life, right? Lifelong trip, essential. That's why I take stem cells. I want to recover and I want not to go back again to further injury to my body, right? It's a stroke. When you have a major stroke, your hands can't move, your legs have difficulty walking, and you walk like that. Lift this thing up. Then you take a normal step, lift this thing up. This is like a dead weight, and therefore, but you can prevent this. If very early in the stroke you start, you can get full recovery. I know a few people who have. A lot of people who use TeraHertz who have stroke. What I see is that they have complications of stroke. That means they were not properly rehabilitated, and they use this. There's some improvement. There are people who have stroke and then the person recover a lot of function. It's quite amazing. You use stem cells, you can recover even more. But don't wait until recover and spend so much money on this. If you can, try and prevent it from the start. That's why I give these talks. I give these talks to educate people so that you can prevent it. Maybe not for yourself if you already have the disease, but certainly, your relations, people you love, who also have the risk factors. You want to get rid of the risk factors and live a healthy, normal life to old age, right? Another thing that overweight gives to is gallbladder. Gallbladder and rapid weight loss can give rise to gallbladder. And of course, all the things to do with diabetes, blood sugar, and overweight lead to cytokines. Cytokines, don't think that the fat, especially in your abdomen, Oh, just fat only what? No. Your fat cells produce a lot of toxic substances called cytokines. Cytokines is one of them. And these cytokines are toxic. There are many chemicals. I don't want to name them. And you don't need to know them. But you need to know that they are toxic and they're produced by your fat cells. They cause inflammation. And inflammation, gallbladder is one place they have. And then you have an infection. That infection is called cystitis. Oftentimes when you have a wonderful meal, celebration, 10-course dinner or more, plenty of alcohol, then you have an acute abdominal attack. I used to have an acute abdominal attack. I didn't realize it was this until one day I go to hospital. They say, no, your gallbladder is swollen. My gallbladder is removed. Gallbladder disease causes colicky pain, nausea, vomiting, fever. It may be jaundice. So when I have those attacks, I thought maybe food poisoning, maybe gastric. Yeah. So that's what it is, and it can be quite serious. The only treatment, remove the gallbladder. Huh? Gallbladder. Gallbladder is that small little organ where sometimes you get gallstones. Yeah. Huh? Tan. They say tan. Huh? Hokkien they call it tan. So all these are gallstones. And some oils and some things like that can cause your gallbladder to discharge gallstone. And I'm sure you heard of some people who want to detox your liver, right? And they give you all those oils and all that. And after that you pass out a lot of stones in your feces, isn't it? Have you heard of this? Yeah, in your gallbladder. So this is the result of usually age over 40, female, and female fat 40 fertile. That means they produce children. We used to remember gallbladder disease, the 4F. But males also get it. Yeah. In other words, some years for the overweight and things to produce this result. Fertile, they have children. Fat, female. But any fat person can get this gallbladder because other risk factors include smoking, alcohol, a sedentary lifestyle, and then they suddenly want to lose weight quickly, cause weight loss, bring forward. So that's gallbladder disease for you. Arthritis. Obesity increase the risk of arthritis. My last lecture was on weight-bearing joints, right? The joints of your legs and your spine, right? Bear all the weight of your body, isn't it? Imagine somebody step on you, somebody's weight on you. You can imagine how heavy it is. What's the weight of a typical person? 50, 60? 70 kg? Imagine that weight on your joint. So wear and tear and heavy body weight, and then because of the weight you don't want to move, you're inactive. When you're inactive, what happens? Your muscles are weak. Your muscle in your ligaments of your joints protect your joint and support it. That's why when I got my arthritis way back in 1986, about 40 years ago, I continued to exercise. Why? It's very simple. When you exercise, you strengthen your muscle, and the muscle will support. When I was in the reservists in the 90s, 10 years after, so it's about 1995, 96. I was in the reservists, doing my reserve with the army, and I have a nursing officer, so we have nothing to do, so we should check. Then he saw me wearing my knee guard. I said, how come you wearing that? I said, I got arthritis. I said, I wear my knee guard, I can do things. I can play golf, I can play games, I can do whatever. Very good. He said, his neighbor, my nursing officer's neighbor, also has arthritis. So because of his knee pain, he went to the HDB, can I have a house, a flat on the ground floor? Last time they have flats on the ground floor. Please give me a ground floor flat because I don't want to climb. So he was given a flat on the ground floor. And what happened? He says, this 10 years, he didn't do any exercise. He's now on a wheelchair. 10 years. So you have arthritis. The best way to overcome arthritis is exercise. Overcome it as much as possible. The effect of wear and tear. Okay? Because when you exercise gradually, and of course, stem cells help to allow my arthritis to recover. So I can run up the staircase. Isn't that good? If I don't do all that, by now, I will be on a wheelchair. I don't want to be on a wheelchair. I want to run up the staircase, isn't it? So remember, your fat cells release toxic substances called cytokines. And if because of the pain, the stiffness and all that, you are inactive, it will make things worse. Remember that. Inactivity aggravates your obesity. Your obesity is better off if you're active, burn of calories. Your arthritis is also better off if you're active. Then it helps your soft tissue to repair itself, and it can get improvement. So how do you deal with arthritis? Reduce your weight, because the weight causes the pressure on your joints. And your joints, the wear and tear increases, and if you don't do anything, It will get worse. Reduce your blood sugar, exercise, and you must take painkillers. I don't want to take painkillers. A lot of people say, why? Huh? Is that so? What are painkillers? Painkillers are called NSAIDs, and NSAID stands for this word, non-steroidal anti-inflammatory drug. So what does painkillers do? What does it say? Anti what? Anti what? Inflammation. That's right. The painkillers don't only relieve the pain, it is against it. Reduce your inflammation. That's why you must take. Addicted, the more you don't take, the less you take, the more you'll be addicted. You understand what I'm trying to say? My wife was told this by her friend. So she don't take. I told her, you know what it stands for? NSAIDs? It's anti-inflammatory. It reduces inflammation. When she realized that, she started to take. Reduce the inflammation, she could move. When she could move, she can exercise. When she exercises, the muscles can recover, right? It's to help you to recover. What's this nonsense? I'll be addicted and all that. That's why you never recover. You understand? If I can't convince you, at least be convinced by the name. It's anti-inflammatory. So you don't reduce the inflammation, you can't walk, and you sit there still, it gets worse, the wear and tear gets worse. You reduce the inflammation, you can move. You can move, your muscles get strengthened, you get better. That's how my legs are normal. Besides stem cells and all the things that I take, it's the fact that I use painkillers. Okay, some painkillers are not anti-inflammatory. That's true. The opioids, tramadol, not anti-inflammatory. Just relieve the pain. You're better off taking tramadol with a anti-inflammatory drug. You want to reduce the inflammation. That's what I keep telling people. The more you're afraid of being addicted to painkillers, the more you'll be addicted because your pain never relieves. It never gets well. That's the bad news I have to tell you. Those who are afraid. Tell your friends, those who tell you that this is Panadol has a very slight anti-inflammatory. These are more powerful anti-inflammatory. There are a lot of drugs. The strong ones where you need to take antacids with it, those are the ones. If the doctor says take this painkillers and take this antacids with it, otherwise your stomach gets, those are the ones that are anti-inflammatory. Understand? Or ask the doctor, is this anti-inflammatory? The doctor will tell you. So you have been misinformed.
No, I don't take.
Huh?
I don't take drugs. I don't take.
Of course, if you no pain, don't take lah. If you have pain, you take lah. You must understand. If you don't understand, you get into trouble. Do the wrong thing, and you think the doctor is trying to poison you. No, doctors are not trying to poison you. They're trying to help you. So when you spell out the name, you understand that the action of the drug is to help you get back to normal. Okay?
I think you went a few slides ahead.
Huh?
You went a few slides ahead accidentally.
Did I? Oh yeah, yes, I did. So osteoarthritis can be cured completely if you do this is gene therapy. You have a gene that produces this growth factor FGF18, and you can get it healed completely. TeraHertz can help. But TeraHertz is inconsistent because you are not medical and you don't know how much and whatever. Stem cells similar in regenerating joint structure to be normal. That's what it does. So, in this picture you see the amount of weight your joints have to endure.
It's okay. Thank you.
And of course, when you have arthritis, the pain is everywhere. And if you can visualize your joint through x-rays or whatever, you can see the kind of that. That's why people go for knee replacement, right? That's why people go for operation, right? That's why people get to the point where they can't walk because you see the cytokines there again, caused by fat tissue. So when we say reduce it, oh, I'm fat, I'm comfortable. No, a lot of things are happening to your body which you are not aware of. So if you're fat, high blood pressure, high sugar, high cholesterol, be careful. You're in for a rough time. This thing helps. Physio, we used to inject steroids just to relieve pain. Steroids relieve pain. Block off all the inflammation. Now we inject stem cells. Get it cured completely. TeraHertz This stem cells, stimulants. Yes, that's what it is. Sleep apnea. How many people in your home snore very loud? How many? You have? You have? Do you yourself do? Okay. One important thing is, where is it? Maybe not here. Sleep apnea is during sleep, you stop breathing 10-30 seconds. And this get repeated up to 400 times in a night. So if you stop breathing 400 times in a night, what happens? You're not getting enough oxygen. I've seen one fellow, he was, I met him in the army, a huge overweight person, you know. And during reserve, he's lying down flat on the floor and he was sleeping and snoring. Symphony. So I said, you better come and let me assess. I did all the tests. I found that his brain functions has deteriorated. Or he was going for something. I was trying to. So I said, you come and assess. Qualify for dementia. In other words, the lack of oxygen has killed his brain cells. Quite bad. So if you have daytime drowsiness, snore very loudly. People who snore very loudly, either they drink a lot or they take tranquilizers. Oh, same effect. You sleep very deeply and your tongue fall back and that's where you snore. Gasping, choking, you awake in the morning with dry mouth and you have trouble focusing in the day. Usually caused by heart failure, high blood pressure, diabetes, and shorter life never mind. Heart attack and stroke. So what do? Reduce weight, be more active, exercise, eliminate alcohol, tranquilizers, change your sleeping posture, put a pillow on your back. Breathe through the nose. One doctor advocates a very drastic solution. Want to breathe through your nose and you have difficulty? Very simple. Tape your mouth. When you tape your mouth, nothing comes out through your mouth. It comes through the nose, right? Quite drastic, isn't it? It worked. Yes, it worked. So there are a lot of other things. Continuous, it's a two valve. There's an implant. This implant inside your neck here, which stimulates your glossal nerve. The glossal nerve activates your tongue. So when it activates, it pushes it forward and you can breathe through normally. So there are a lot of oral and nasal implants that has been used, but you don't have to use this if you do simple measures. So sleep apnea is caused by your tongue. This is your tongue, right? Your tongue is here, air can flow through, right? If your tongue fall backwards, well, it blocked. And so either you must sleep on your side. Sleep on your side. Left side or right side, it doesn't quite matter. Although some say left side is better. Anyhow, so you sleep with your head higher than your body, or put a pillow there, this way or this way. I sleep like that. That's my normal sleeping position. This is it. EPAP. Two valve light in the nose. It build up pressure so that it keep your nose open to allow for nasal breathing. Continuous positive airway pressure. A valve with oxygen. I mean, if you are very bad, then this costs more money. This is an implant. The implant has built-in a sensor which detects how your sleep is, and when it detects that your airway is blocked, it trigger impulse, activate your nerve, push your tongue forward, and you maintain your ability to breathe normally. These are some of the ways to overcome sleep apnea. This is important because I think your quality of life is terrible, and that's why I don't recommend excessive drinking. Excessive drinking can cause this. Cancer risk. How many years ago? Maybe 5-10 years ago, there was WHO did a study on obesity, and they concluded that obesity is actually a risk factor for all cancers. All cancers means all cancers, but definitely in 14 of them, you saw the earlier slide, right, where it caused all the cancers. And these are all the common sectors, and all come about because of the inflammation caused by the cytokines released by your fatty tissues, as well as by insulin. Insulin is a growth factor called insulin growth factor, which can provoke this. For cancer patients, the more obese you are, the higher your BMI, your outcome not good. So cancer risk factors can be modified if you exercise, if you have healthy diet and habits. There is no reason why. Oh, what happened?
Battery, is it?
Okay, it's back. Now, I've said how much the cancer is able, stem cells is able to reverse the damage. This is very similar to stem cells. T cells are actually harvested the same way from your bone marrow, and T cells, so certain type of T cells are naturally able to attack cancer cells. So we have the means available nowadays to really prevent cancer and to really attack cancer in a very effective way. And of course, these are all newer methods of treatment, not beginning to be available. So we're very fortunate we live in an age where you don't have to endure a lot of the nonsense of cancer treatment side effects. So these are the kind of foods, right? So kinase work by blocking the signal, so cancer cannot grow. This is how your T cells that attack cancer, they hook it to a receptor called the antigen receptor, chimeric antigen receptor. So when it's linked up to the antigen, this gets carried to the cancer and attack the cancer cells. So no side effects, because the side effects from current cancer treatment is because the drug also attack your body cell. That's why you have hair loss, vomiting and all that. So this treatment, no side effects. But don't do this. Decide healthy diet. Yeah. So that's why some people go vegetarian for that reason. But I think if you moderate your lifestyle, I believe that life is not worth living unless it is enjoyed, right? So can I enjoy my char kway teow? Can. Once a month, yes, you can. Because once a month your body can handle the toxins. Can I enjoy roast pork? Yes, you can. Don't take every day. Don't take humongous amount each time. You can. Because these are the fruits that will reverse the effect. So foods that are bad, this pasta and pizza are not healthy food. They're not healthy food. So by all means, you want to enjoy them, go on. But don't make it a regular habit of eating unhealthy foods. Okay. Obesity causes a lot of psychological issues, low self-esteem, disordered eating, negative body image, and not only that, your quality of life is reduced because you can't do so many things, and you can't endure things, you can't balance coordination, movement is difficult. Ever seen an obese person? I've seen nowadays on the streets, obese person have difficulty walking. So lifestyle change is therapy. Exercise has immense positive psychological benefits. Meditation produces the same effect as TeraHertz because it uses the same mechanism in our body to produce a good effect. And if you use TeraHertz, if you meditate, double the effectiveness. See, structured behavior. I'm thinking of offering this because a lot of these things have to do with behavior change. And behavior change, people find it difficult. And because people find it difficult, they sometimes they can go at it for 1 month, maybe 2 months or 3 months, and after that they stop. They go back to square one. So you must believe that temple, we got to choose. Which one will you choose? A lot of people choose this. In their head, they know it's apple. But in their heart, they will take this one. Right? And of course, it's external environment. If you're on a seafood diet, dangerous. But you must also regulate internally. The internal is more important. Reduce the hunger, reduce the occupation with food, reduce all this. This is external. Your weight gain has a fixed point. Why people have difficulty losing weight? Because if let's say they're 90 kilos, there's a fixed point. They try and reduce, they gain back. Weight loss program up to 30% is effective. You see all the weight loss program, only 1 in 3, less than 1 in 3 is effective. Is ineffective. And I was in Stanford University many years back doing one of the things was weight loss program. Their results is here, 40%. That's how I know. With the best results, surgery, medication, everything, the effective of weight loss program is only less than half. I say this, if you have anybody who want to lose weight and can't lose weight, this is the reason why. Because it has to do with lifestyle change. And lifestyle change is very difficult. So how do you do this? You must be aware of medical complications, pay attention to diet, monitor keep blood pressure, monitor all these things, reduce cholesterol, meditate. Very important because motivation is very important. The longer you meditate, the better the effect. So minimum 5 minutes. If you can 15 minutes. If you experience, you can go on to 30 minutes. The more you meditate, the better you are. That is proven. And make use of TeraHertz. So therefore, a lot of things can be done, and it's not easy. I have worked with heart patients to reduce their lifestyle risk, and it's not easy. Very few people succeed. With exercise can do a lot of things. Burn up calories, reduce glucose level, because when you exercise, all the glucose go into your muscles. And when you exercise, your muscles, all your soft tissue becomes stronger. When you exercise, your inflammation goes down. That's why no matter how bad your joint is, take the painkillers and exercise. Your inflammation will go down. That is the reasoning. If your exercise is too intense, too long, inflammation goes up. That's why you find people when exercise every day, then they come down, joint problem. That's what happens. Exercise every day, then suddenly have heart attack. Like exercise within your limit. See? Don't overdo things. The fanatics don't live long. Regular exercise, moderate intensity, increase muscle mass, you burn less calorie, even at rest. So all these things. Exercise, by the way, stimulates stem cell release. So besides taking foods that cause a stem cell be activate in your body, another means of increasing stem cell activity is exercise. See how much exercise is meant. If God don't intend you to exercise, He won't give you 2 legs. So 3 times. The older you get, the more you need to do is strengthen your muscle. Any old folks, ask them to lift up their finger. You see a flap here, right? You can flap the thing. The chicken wing flap. That comes about because as you get older, you lose your muscle. And when you lose your muscle, you feel cold. When you lose your muscle, you don't burn enough calories. That's why you feel cold. And when you lose your muscles, what happens? You're not strong. You get weaker. To maintain your muscle, you must have muscle strength. Benefits of exercise. There are mental health benefits, there are physical benefits. I can give a whole lecture on this. So, I don't think I need to convince you, right? It's so obvious that you should exercise. Right? Exercise group. There are walking groups, cycling groups, jogging groups, all kind of exercise groups all over the island. There are groups to play badminton, groups to play whatever. My classmates, my old classmates have a regular walking group where they walk from one place to another and attract a lot of people. It's good. So these are all the benefits, health benefits. So how about the use of TeraHertz devices? Can we use TeraHertz devices? How to use that? Use it to regulate. It stimulates endorphins. Endorphins are painkillers. Your body's natural pain. Stimulates that, relieve pain, reduce inflammation, improve circulation, all the benefits. If diabetic, be sure you track blood sugar daily and get anything, even the patches, anything that will regulate your blood sugar. If you have cholesterol, take medical advice whether you should go on medication, meditate, connect with people, have meaningful relationships.
The monitor, small monitor. No battery.
No, this thing. So, your TeraHertz devices can be used for many things. Okay? And so these are some of the TeraHertz devices that are available for purchase. First, we sell this. And besides TeraHertz devices which you can use stem cell stimulant or stem cell. Stem cell treatment itself is expensive, so we make some stem cell stimulant. They repair and regenerate pre-existing damage. Also, if you are using stem cell stimulants, the stimulants usually are very health positive. They produce anti-cancer, antioxidant, anti-inflammatory, anti-diabetic. They can also have beneficial effects on your eyesight, osteoporosis, and so forth. So if you can repair the damage from your past illnesses, you can restore full function. See? And also function that is lost as a result of aging, this thing can repair. It's particularly active in bones, in joints. That has been proven more than 20 years ago. Heart muscles definitely, and specifically for strokes, Parkinson's and things like that. It's effective. So that's what we should do. These are all that's available. There are many. You want to know which is more effective? You can discuss. Yeah?
Oral.
These are all oral. Real stem cell treatment is by infusion or by injection. But all these are oral. This is. They don't need prescription.
So just can buy it from any.
Yeah, you can buy it. Yes. This is stem cell injected into the knee with the help of an ultrasound. It's an ultrasound. So all these are oral, you see. And if you want to get them, contact MK or myself. We can help you to get them.
Is that expensive?
Depends on what you are getting. You pay so much, you get so much. The cheaper ones, as cheap as $100 a month. The most expensive can be few $100s a month. 400 or 500.
I thought you said this
Usually
TeraHertz.
no side
I
effects.
thought this TeraHertz will help.
Huh?
You said the machine will help.
Yes, it does help. I said just now in the earlier slide.
You only use this
Depends on your objective. My objective is I want to optimal. I use both, right? So, you guess my age?
55 plus.
75 stem cells. I don't have age spots, all removed. Thanks to TeraHertz. TeraHertz have to remove it. So these are all positive effects. I want to live as long as possible and live a life as good as possible. So I use everything. You want to stick to one? That's your choice. Who am I to say? I shared with one of my classmates what stem cell is like. He says, oh, never mind. I prefer to go to my second child. That's your choice. When you go to the second child, you know what second child is like? Demented lah. Huh? If that's his choice, what can I say, right? He wants it. I can't say no. So, your choice. But if you want to make this the right choice, we have a group of people who want to improve their health status with the best means possible. And TeraHertz stem cells are the two most exciting discoveries. Doctors, universities researching. It's not what Wong Bong Chong or Li Ming is doing. These are doctors in universities. And for that reason, I think I will trust these people more than whatever Goyo seller is peddling. So ultimately, it's about choices. And I'll probably send out a news item. Anybody who has difficulty making lifestyle change, maybe I'll run some group people who want to make lifestyle changes because it is not easy. As I show you the figures, less than a third are able to make the kind of changes. And that's generally true. But it's also true that sometimes in such programs, if you offer it free, it won't work. The more people pay for it, the greater the motivation. Somehow. How much are you willing to pay? And when you ask that question, sometimes I'm not willing to pay. It's what they call exchange. If I charge you $100, you think, what can $100 buy me? A meal in one of the good restaurants in town, or a ride some amusement park. How much can $500 buy me? So how much can $1,000 buy? If I'm willing to put a lot of money into it, it increases my motivation. Unfortunately, it's true. I've seen this happening. So therefore, lifestyle change, we have to make that. It's all about healthier mind, good healthy habits, positive outlook, takes time to reduce stress, spend time with loved ones. That's my philosophy. I want to be able to enjoy the things I enjoy. I want to be serious so that I can do useful things. I also want to have lots of fun and laughter in my life. I believe that will be your goal too. Unless, like my friend, he wants to be in second childhood. So TeraHertz to repair and regenerate with stem cells, and the biggest risk a person can take is to do that. So if you know of anybody who is overweight and don't want to do anything, then you will face all the results of that. So inflammation, pains, blockages, that's what it's used for, right? And what it should not be used for? Pregnant women, acute disease, you should be in hospital. Congenital, probably you need to repair. Implant, now we know it's what's safe. Open wound can be used.
Hello, doctor. People
Yes?
operate and put a metal inside the knee. Can use it?
Huh?
You operate
Implant can be used.
got metal inside.
Depends on where is it. What metal? Do you know what is the metal in the implant? Huh?
Joint fracture, then you put something inside.
What is the metal?
I don't know. You use it.
According to experts, most of the implants, the knee replacement, the hip replacement, they're made of titanium.
Many years ago, you know.
Titanium don't absorb heat. It reflects heat.
So can use it.
But you got to use it with care because the company say cannot use. So you use it at your own risk. You understand? The thing is, it has been used. And the reason why it can be used because this is only for home device. Right? The energy is fine. How many doctors use lasers? Skin use, right? Laser of your face. All kinds of lasers have been used. And medical grade lasers are very much more powerful. So if you put an implant, you put a thing and they can't use laser, then doctors' hands are tied. So they have looked into this. Say yes, can be used. Otherwise doctors can't treat them for other things. This is nothing. When this compared with medical lasers, world of a difference, see? So at first initially I just follow what the company says. Then people ask questions. So I go and look up and I find that titanium don't absorb heat. It reflects. That is the property titanium. And anyway, any heat that titanium absorbs is very mild. There you are. That's what the expert says. I'm not an expert on titanium. I'm not an expert on implants. But it's all on the internet, right? What I tell you is what I found on the internet, which means that you can find it need to improve. Okay, so that's the end of my talk.